Hello class and welcome to your chapter 14 lecture. Today we're going to be discussing inhalants. So the learning objectives for today's lesson are that by the end, you should understand that inhalant use is harmful and that even one-time use could lead to sudden sniffing death syndrome. I know it sounds fake, but it is not. You should be able to identify the major groups of inhalants. List the household and commercial products that are most often abused as inhalants. Describe the principal means of using household and commercial products as inhalants. Identify the signs of abuse. Examine the current patterns of abuse among various groups. And list the dangers of inhalant abuse. So let's jump in with an introduction. So inhalants are described as a volatile substance that elicits a psychological or physiological changes within the body. Most inhalants cause either intoxicating or euphorogenic effects for the user. Many substances that are never intended for human consumption are typically used as inhalants, including household and commercial products, which we'll discuss. Inhalant use is highest in 8th graders and does tend to decrease with grade advancement. So using inhalants as looked at as more of a childhood drug use or drug issue rather than for adults. So among adolescents aged 12 through 17 who used within the past year, over half of those used between 1 and 11 days, while 8% used on more than 100 days. So while that may not seem like a lot, 8% in this cohort, that's still a lot of youth who are using inhalants, especially when sudden sniffing death syndrome can occur after just that one-time use. This is a concern. And lastly, inhalant use can cause that sudden sniffing death syndrome, as well as injuries and damage to the brain, your heart, kidneys, and your liver. So if we look at the history of inhalants, we're going to start with 1776 when a British chemist, Joseph Priestley, synthesized nitrous oxide. This is a colorless, tasteless gas with a slightly sweet odor. In the 1840s, we then had a dentist, Horace Wells, who allowed his own tooth to be extracted while he was under the influence of this gas. It was successful, and he did not feel any pain having the tooth removed, which is why this is usually used in dentistry. Then in the 1950s, the news media reported young people starting to get high from sniffing glue, which brought public attention to the abuse of inhalants. So what are the major groups of inhalants? We have volatile substances, anesthetics, and nitrates. So starting with volatile substances, these are going to exist as a gas or a liquid that vaporizes at room temperature. So some of the types we have are aerosols, art or office supplies, adhesives and fuels, or industrial and household solvents. There are 3 different methods to using inhalants. So you can have sniffing or snorting, which is when a person inhales the vapor directly from its original container. You also can have bagging. So bagging is when an individual inhales that solvent from plastic bags. And then huffing. So an individual will soak either old rags or bandanas in the solvent fluid and then hold it over their mouth and inhale that way. Some of the acute effects you can have from inhaling these volatile substances. First is nausea. You can also have irritation in some of your airways that causes either coughing or sneezing because it's not meant to be in there. You also have this sudden sniffing death syndrome due to serious cardiac arrhythmia. So SSDS is a condition that's characterized by a serious cardiac arrhythmia or an irregular heartbeat that occurs either during or immediately after inhaling the substance. and this can occur after just one use. We also need to talk about low doses versus high doses effects. So in low doses, a person may experience brief feelings of lightheadedness, mild sedation followed by a loss of control, a lack of coordination, and disorientation that's accompanied typically by dizziness and possible hallucinations. Some of these sound similar to alcohol, right? And then you have your high dose effects. So in high doses, you may have relaxation, sleep, or even coma. And when these substances are used long term, it can cause hypoxia, which is a state of oxygen deficiency. This will then cause brain damage or even death. A few other effects that we can have include hypertension, damage to the cardiac muscle, your peripheral nerves, and even your kidneys. A person can experience a loss of appetite or be continually tired. When you're sniffing them through your nasal passages, it can cause nosebleeds, and some of this damage may end up being irreversible. So what are some of the different types of volatile substances that we have? The first is aerosols. So aerosols are abused because of the effects of the propellant gas, not the principal ingredient. So let me say that again. With an aerosol, the user is intending to inhale the gas that propels the product out of the container. They're not attempting to inhale whatever product is in that container. And it's dangerous because these devices are capable of generating high concentrations of inhaled chemicals. We then have toluene. So this is a highly lipid soluble, meaning that it is rapidly absorbed by your brain, heart, and your liver. It will activate dopaminergic activity, but it can also cause damage to the liver and kidneys, as well as brain damage, impaired cognition, and gait disturbance. So a person may not walk correctly, which is due to a loss of coordination, damage to your equilibrium, loss of hearing, and even loss of vision. Other types are butane or propane, and the concern here is that they can cause very serious burn injuries because they're flammable, and it can also cause sudden sniffing death syndrome. Similarly, gasoline can also include your toluene and benzene causes impaired immunologic function, injury to your bone marrow, can cause an increased risk of leukemia, and also reproductive system toxicity. It is highly flammable, and fires or serious burns can result from using this improperly. And finally, we have Freon. So this is used in your refrigerators, air conditioners, some air brushes for art users. And this using Freon can cause serious liver damage. It can also cause SSDS or freeze injuries to unprotected parts of your skin if the user loses consciousness while they're using it. So this product should not have contact with the skin. We then move into anesthetics. So anesthetics are typically sold in large balloons or whipped cream containers. They're going to be cylindrical or plastic containers that are filled with nitrous oxide, and that's called whippets. This nitrous oxide can also cause, though, a loss of sensation, limb spasms, altered perception, and motor coordination. You can have a blackout from your changes in blood pressure and also reduced cardiac function. So some of these types are chloroform, halothane, nitrous oxide, also known as laughing gas, and then whippets. And again, severe hypoxia or death can result from an acute overdose. So you don't have to use these long term to feel or have the negative effects. We then have nitrites. So nitrates causes vasodilation, and amyl nitrate has been used in the past to treat angina. So this is a condition marked by severe pain in the chest, often also spreading to your shoulders, your arms, the neck, and it's typically caused by an inadequate blood supply to the heart. So these were prescribed to treat this condition. However, they started to be abused as sexual enhancers, and they were first abused in the 1960s when they became available over the counter as ampules that you could pop between your fingers and then hold up to your nostrils to inhale. So because of the fact that you would pop them and then inhale it, they were called poppers. So what are some current patterns of inhalant use? Well, again, we previously mentioned that typically it's going to be your teenagers, your adolescents that are using them. So they are popular because they can be legally obtained. They're also readily available. If you think about it, most of these household products you could just find in your kitchen, in your cleaning supply cabinets. For those who are artsy, you may have them just sitting in your art studio. They're typically inexpensive, easy to conceal, because who's going to be concerned about a hairspray container sitting around? And most users are unaware of those potential dangers. They don't see it as being, say, a concern as maybe snorting cocaine, because, well, we all know cocaine has very negative effects, but no one really talks about the negative effects of inhalant use or SSDS. So looking at adolescent and teenage use, it does decrease with age. So among high schoolers who used one time in their life, we see about 8.7% of 8th graders used, 6.5% when they got to 10th grade, and then 4.4% when they got to 12th grade. So you can see that use is diminishing. And then among adolescents who are between the ages of 12 and 17 who used in the past year, as we mentioned before, about 59% used between either 1 and 11 days, while 8% used 100 or more days. So we see that the increased use the percentage of users goes down as there's more use, but it's still a concern that you have about 60% of adolescents saying that they have used it at least one time in the past year, some of them using it up to 11 times in the past year. And knowing that SSDS can occur, we need to make sure that parents are aware of these concerns and that teenagers and adolescents are aware of these negative effects that can occur. Then if we look at gender, race, socioeconomics, and abuse, we find that men and women do typically use inhalants at similar rates. Though non-Hispanic whites aged 12 to 17 do report the highest rates of abuse, while American Indian or Alaskan Natives have the lowest use. So, American Indian or Alaskan Natives report use at about 5.1%, while non-Hispanic whites reported use at about 9%. In between there, we have Asians reporting at about 7.7%, Blacks and African Americans reporting at 8.5%, and Hispanics and Latinos reporting at about 8%. So again, your highest rate of use is among non-Hispanic whites. Your lowest rate is among American Indians and Alaskan Natives. So what are some signs that we can look out for in children or teenagers, adolescents who may be using inhalants or abusing them? We want to look and see, are they uncoordinated? Do they have that gait disturbance? Do they appear to be drunk or disoriented when you see no other reason why they should be acting that way? Do they have red or watery eyes? Is their speech slurred? Are they nauseous? Do they complain of headaches? Do they have nosebleeds frequently? And do they have rashes around the nose and the mouth? Because if you're putting these chemicals, say you're going to soak it on the rag and inhale it that way, you may end up with burns around your mouth and nose area, or may be irritated because those chemicals are not meant to touch your face, nor are they meant to be inside your body. So children who frequently use may tend to collect unusual assortment of chemicals in their bedroom. They may have breath that actually smells of a solvent. They may appear drunk for short periods of time, tend to have the sniffles a lot. You ever meet a teenager who just constantly has the sniffles? This could be a sign. They typically won't do well in school, and they may appear unkempt, because if you look at a lot of these signs of inhalant abuse, it may be very hard to upkeep with your hygiene and putting yourself together in the morning when you're having all of these symptoms presenting from using inhalants. So let's briefly just discuss a few of the dangers of inhalant abuse. So again, we have physical damage to organs such as your heart, lungs, liver, and the brain. Someone can die simply by choking on their own vomit because, again, you may get nauseous. And if you pass out after using them and you can't roll yourself over, that's a concern. There's fatal injury from accidents, just as with any other drug use. Either just you individually getting yourself into an accident, getting into the car, getting in an accident, because you have that gait disturbance, because your mind is clouded now. You're not as careful. There's also a risk to newborn babies for developmental deficits and abnormalities. Long-term use leads to mild withdrawal syndrome and typically compulsive use. So again, with any other drug, you can become addicted. And inhalant users are more likely to initiate the use of alcohol, cigarettes, and other drugs at younger ages. They may also have a higher lifetime prevalence of substance use disorders. So if you think about it, we've discussed how the earlier a person uses in their lifetime, the more likely they are to either use more drugs or to use drugs longer, to have higher rates of substance use disorders. So what's the first item a child may be able to get access to? It could be argued now that it's maybe marijuana or cigarettes if the parents are smoking. But you look at these different household products, I mean, you're supposed to lock them up as a parent for your children, but sometimes they tend to get into things, and it's just possible that a very young child could get a hold of one of these substances and inhale it, either knowingly or unknowingly, with the negative effects. So that's one of the reasons why. All right, in sum, inhalant use can cause sudden sniffing death syndrome, even if it's used just one time. Inhalant use damages vital organs, including your brain, your heart, lungs, liver, and kidneys. The three major groups of inhalants are volatile substances, anesthetics, and nitrates. Aerosols, art or office supplies, adhesives, fuels, and industrial or household solvents are most oftenly abused as inhalants. The three main methods of inhalation are going to include sniffing or snorting, bagging, and huffing. Remember, sniffing or snorting is inhaling the substance directly out of the container that it comes in. Bagging is spraying it into a plastic bag and then sniffing out of the bag or inhaling out of the bag. And then huffing is soaking either an old rag or a cloth, doesn't have to be an old one, could be a new one, but soaking a rag or a cloth in the substance and then holding it over the nose and mouth and inhaling. Some of the signs of abuse are going to range from incoordination, disorientation, red and watery eyes, nausea, nosebleeds, and even rashes. The use of inhalants among high schoolers will tend to diminish with age. So again, we have the highest rate of use in 8th graders and then your lowest in 12th grade. Men and women do use inhalants at similar rates. Non-Hispanic whites between the ages of 12 and 17 report the highest rates of abuse, while American Indian and Alaska Natives have the lowest rates. And finally, dangers of inhalant abuse can include death, injury, choking, damage to vital organs, and if the person is pregnant, risks to newborn development. So that was your Chapter 14 lecture on inhalants. As always, if you have any questions, please feel free to reach out, and I hope everyone has a fabulous week.